The flu virus remains a major concern, even as cases in Western New York could be trending downward. Joining us now to talk more about when you need to go to the hospital are Brianna McCarter and Andrew Knoll from AMR. Thank you both for joining us this morning. Andrew, or Brianna, but I know, Andrew, you kind of have more of a handle on the stats. Kind of talk about what you guys have been seeing lately with flu cases.
Sure. So in the last week and a half, we've seen a 29% rise in our influenza-like illnesses and symptoms. We've also seen increased offload delays at the local hospitals. A lot of the local hospitals are reaching or beyond their capacity to treat patients, which is creating offload delays for us, and sometimes excess of 5 hours our ambulances are sitting at the hospitals.
Now, Brianna, what are you seeing in terms of symptoms when people call 911 and you show up?
So people are experiencing shortness of breath sometimes, aching, body pains, vomiting, nausea, diarrhea, those symptoms as such.
Mm-hmm. And when it comes to dialing 911, when should someone, if they have the flu, they're experiencing symptoms, when is that moment where calling 911 is an option?
If you feel like you're having severe chest pain or severe shortness of breath, we recommend that you go and get checked out at the hospital or call 911. If you're just having mild symptoms, you have to keep in mind that we're taking care of a lot of really ill patients right now, so we don't want the hospitals and the 911 system become overcrowded. So if you are having mild symptoms, we recommend staying home because it may be safer. By all means, we're not saying do not call us and don't go to the hospital, but just for your own safety, we would like for you to stay home and treat yourself.
Yeah, and then Andrew, just how does this year kind of compare to previous years in terms of how many people you guys are seeing having the flu? Sure,
I think as some of the public health officials already stated this year, respiratory illnesses have hit earlier. Normally we don't see a spike in respiratory illnesses or influenza or even RSV until later in January, early February. So these have started much sooner, and shortly after the holiday gatherings that we're seeing these spikes. And the good news is I'm hoping that they're kind of plateauing and on their way down right now, but there's always an indicator lag of seeing that work in the hospital systems.
Is this something that crews prepare for as we get into flu season?
Sure, I think we're always trying to mitigate the risk and educate them on the risk that they're going to take, and have them understand where they're going to see spikes in calls and what they should do to help with that. And then we're also trying to help load balance and try to dictate where patients can go to not overburden certain hospitals.
Okay, and Brianna, any tips for people, for residents out there who are feeling ill, and just any advice you have for them?
If you are feeling ill, this is a perfect time to have a primary doctor. Sometimes this can be settled at home. You can make a phone call. They can prescribe you medications, or they even have video chatting now so that you don't have to go anywhere. Make sure you're washing your hands, stay well rested, stay hydrated. If you have small children, keeping them home from school if they're not feeling well. And also, if you're going to see people that are in the hospitals or nursing homes, please wear a mask. And if you have to be around anyone in particular, just wear a mask so that you're safe.
Okay, good reminders and tips for folks out there. Well, thank you both for joining us this morning.